World AIDS Day, a global moment of remembrance, solidarity, and renewed commitment in the fight against HIV and AIDS. This year's theme, Overcoming Disruption, Transforming the AIDS Response, a call for sustained political leadership, international cooperation, and human rights-centered approach to end AIDS by 2030. After decades of progress, the HIV response stands at a crossroads. Life-saving services are being disrupted and many communities face heightened risks and vulnerabilities. We speak now to Ms. Winnie Byanyima, Executive Director of UNAIDS. A very good evening to you, and thank you so much for taking the time to speak to us, Ms. Byanyima.
Good evening, Sepiso, and thank you for having me.
Perhaps it's fitting that we start with the global perspective. The past 2 years have seen a regress in the prospects of survival and life-saving interventions because of funding gaps and geopolitical conflicts. What is a snapshot of where World AIDS is today, 2025, compared to, say, World AIDS Day 2023?
Around the world, there are almost 41 million people living with HIV. Out of those, about a quarter of them are not yet on treatment, 9.2 million. We need to get them on treatment to live long, healthy lives. Also, last year, there were 1.3 million people that were newly infected. So we have a job to do. We've got progress that deaths are coming down, 630,000 last year, but we still have deaths. We have people coming on treatment, but still we have 9.1 not yet on treatment, and we have new infections every year. So we are making progress. We have been making progress, but we are also slow. The progress is slowing. And now, this year, UNAIDS is sounding a very loud caution because suddenly we are seeing rapid cuts in international assistance. And for the high burden countries who are low income countries in Africa, international assistance has been core to the progress that has been made. So now with it being cut this year alone, we see that international assistance for global health will come down by almost 40%. That is compared to what it was in 2023. This rapid decline doesn't give room for low-income countries of Africa in particular to plan a way to fill the gap. They are choking on debt, and the debt issue isn't being resolved fast and substantively enough for them to have space to invest in the health of their people. They are also losing a lot of money through tax dodging. Tax loopholes are not closing yet. There's a discussion going on at the UN, but it's not concluded. And so the possibility of filling the gap is not really big, but we see countries trying. We see them trying to reallocate to health from other sectors, reprioritization. We see them putting new taxes in place, like sin taxes, taxes on tobacco and things like that, in order to raise more money to put in health and in HIV/AIDS, but not enough. So we are calling on the donors, stay there. You fought. This is a global response. This is not charity. This is about ending a disease that knows no borders. Stay on course, because we can end AIDS by 2030 if you stay on course, if we use the money as effectively as possible, and if the African countries can find ways to open more fiscal space and invest their own money in the response. So a fragile progress is under threat because of funding cuts, but also because of reversals in human rights. I can say more on that too.
And I want to look at those reversals, Ms. Byanyima. You've been in the space for decades now. Is this the worst funding crisis that the globe has found itself with regards to the AIDS response? You also spoke about domestic resource mobilization. Given just how constricted a lot of countries are, a lot of them nowhere near the WHO's fiscal budget targets, how grim is the picture then going towards 2030?
Well, first, for the big burden of HIV/AIDS is in sub-Saharan Africa. I mean, Africa represents 19% of the global population, but it has 65% of people living with HIV. They are here in Africa. So the burden is here in Africa. But again, as I said, these are the same countries that are choking on debt. And that debt, we need to understand, didn't come about just because they were borrowing recklessly. Not really. Interest rates spiked since COVID. And then also with the war in Ukraine, interest rates went up. So what they borrowed some time ago, now the interest was multiplying 3, 4, 5 times. So today they are paying more towards repaying debt, interest on debt, than they are putting in health. So it's a problem that is not primarily internal, but it's in the global system that needs to be solved in the global system. Meanwhile, the aid that was supporting these countries that are putting their money in but need to fill a gap is being taken away, because the same countries that had been putting it forward are putting it in defense, in making more weapons, in geopolitical tension. There is escalation of making weapons. So sadly, the money that should save lives is going towards the ends that are not good. But that's the world we are in. But we're seeing Africa rising. We're seeing a reset, Africa Reset, an initiative by President Mahama of Ghana, trying to move countries towards health sovereignty. 25 countries in Africa which we work with have been writing sustainability roadmaps, planning their way towards fully financing their own response. Efforts are there. Our concern is that they cannot fill the gap now, given the fiscal constraints that they face. South Africa is a luckier country. It already finances more than 80% of its own HIV response. What has been lost through these funding gaps is about 17%. And South Africa has moved quickly to fill that gap in very innovative ways. Not completely filled, but largely filled. The gap is largely filled for South Africa. South Africa has 7.8 million people living with HIV, and of those, 6.3 are on treatment paid for by South Africa. 1.5 million need to get on treatment, and we support as much as we can for South Africa to get them all on treatment. But the problem in South Africa is less severe than for the rest of sub-Saharan Africa.
And I want to focus on that political
problem. It's also a rights problem, because rights are also being pushed back, and that's a problem too.
So let's look at the rights problems, but alongside political commitment that obviously is central to achieving that goal of ending AIDS by 2030, and whether it's possible given the rollback in the victories that you say had been achieved prior to the funding cuts. If we're saying disruption, what are some of the more innovative interventions that you have seen, not only in the global south, but in in the northern hemisphere? But I say this against the backdrop of the figures say every single day, 550 adolescent girls and young women become infected with HIV, most of them being in sub-Saharan Africa. What are still the main issues, the problems?
Exactly. As I said, there are 1.3 new infections. There were last year. And most of these in the African region, are adolescent girls and young women. This is really just because girls, young women are less valued in society than men and boys. There are opportunities for education, for safety, for living lives that are free from violence is reflected in their vulnerability to HIV. That their girls are not in safe spaces like school. Many girls who should be in secondary school are out there farming, in shopping centers, working amongst adults, and they are vulnerable to unwanted sex by older men. We have a context where sexual violence is it goes on with impunity. South Africa, recently I was there when you declared it a national emergency, as it is, as it should be. So this is a big driver of the risk of young girls and women to get HIV. We address that by closing the gaps on gender inequality. We address that by giving opportunity. We address that by expanding sexual reproductive health and addressing sexual violence. But these things today, these rights we won, are also being pushed back. We've seen legislation coming in, even trying to remove a ban, for example, on female genital mutilation. Thank God it didn't succeed, but there was a push. Sexual and reproductive health and rights being pushed back. Sexuality education in schools being halted. These are the things that can keep girls and women safe. But today we have a highly organized, well-funded pushback against human rights, gender equality. This is also the same for LGBTQ people. Gay men may be able to get what they need, but are hiding from the law in many countries. In the last few years, we were seeing decriminalization of same-sex relations across the world. Countries were repealing those archaic laws, ugly laws. But today, this year alone, we saw criminalization on the rise again for the first time. Burkina Faso, Niger, Mali, Trinidad and Tobago in the Caribbean, these countries introduced criminalization. We are seeing Ghana also wanting to reintroduce its law, which is already there. It already has a law criminalizing same-sex relations, but it is copying Uganda, wants to bring back the law and increase the penalties for same-sex relations. So this pushback is also pushing people away from services, where there's opportunity to get a service, they don't go because they fear the law. So it's a funding crisis. It's also a regression on rights. And if we don't push back and claim these rights again, even with all the innovations, we can't end AIDS. Lastly, we have opportunity. We have opportunity to stop new infections. We have these magical medicines that are injectable, that would take us towards ending AIDS as a public health threat, only if they can be rolled out, only if they can reach all those who need them and not trickle in slowly because we don't have the money and the price is still not right. We have to get the price down. We have to register. South Africa should be producing for the region because it has the technology. But we need to get the owner of the technology to license a company in South Africa, as they have licensed some in India, even one in Egypt. We need more licensing in the Latin American region, in Sub-Saharan Africa, so that prices come down fast, more is bought, people are reached, and we drive down new infections, we can end AIDS.
Just a quick and final one, Mayor Byanyima. You're referring to the biomedical interventions, and we've heard about this advances in digital health solutions. But I want to focus on conflict zones because they are, most worrying in the sense that there has been a disruption of medical health services, life-saving services in this regard. Is there anything that we have seen that stands out as African-led solutions that can help inform global health strategies in terms of resilience?
We do have more infections. We see that when wars erupt, when climate shocks happen, we see people fleeing, leaving where they have been getting services and going to new places where they are not served or underserved. So crisis, whether it is conflict or a natural, or shall I say, a disaster that is induced by global warming, all these are taking us back, and they are frequent in Africa. We are seeing more and more adverse weather events that are more and more severe and happening every year, more frequent, and resulting in displacement. And sadly, we are seeing Africa also losing on democratic gains, more countries falling under armed rebels, more parts of our continent completely closed to government control, not under government control, clinics closing, hospitals, schools closing. These are also taking us back in the fight against HIV/AIDS. We have to have very specific interventions in those countries, and we've been trying to be present in those countries to offer support as UNAIDS.
Thank you so much for your time and sharing insights into the direction where we are globally, regionally as well, with regards to World AIDS Day. As I mentioned